There is what is called Jarisch Herxheimer reaction. This Jarisch Herxheimer reaction is a temporary inflammatory reaction that usually occurs shortly after starting antibiotic treatment for syphilis, caused by rapid death of the bacterium Treponema pallidum. Also note that this is not a drug allergy. This is not allergy to antibiotics. It usually occurs within 1 to 24 hours after starting treatment. It is normally seen in diseases caused by spirochetes. For example, in syphilis caused by Treponema pallidum. Treponema pallidum is spirochete because its structure looks like spring. That is, it is coiled as spring-like. That is what I mean by spirochete. They are spirochetes. It is usually common in penicillin treatment because penicillin is used for treatment of syphilis. Also note that this is not a treatment failure. It signifies the rapid death of the bacteria Treponema pallidum, or in other diseases caused by spirochetes. It is usually seen in primary syphilis, secondary syphilis, and early latent syphilis. So why does Jarisch Herxheimer reaction happens? It happens because antibiotics kill large number of the bacteria Treponema pallidum rapidly. These dead bacteria release lipoprotein and inflammatory substances. These inflammatory substances trigger cytokine release, which is inflammatory chemical. This will now cause systemic inflammatory response. And again, you should know that this is not a drug allergy. This is not an allergy to antibiotic. This is not a drug toxicity. Rather, it is caused by rapid death of bacteria. It is due to rapid bacterial death. Common signs and symptoms. Symptoms are usually temporary and flu-like. These symptoms include fever, chill, headache, muscle and joint pains, fatigue, sweating, temporary worsening of syphilis lesion. For example, rashes may worsen. Symptoms usually last 12 to 24 hours, rarely longer. The people at high risk include patients with high bacterial load and patients with secondary syphilis. Also, patients at early stage disease and patients at first time treatment. You should know that this is not a penicillin allergy and it is not a treatment failure. Also, it is not a drug toxicity and not a reason to stop antibiotic treatment. That is penicillin treatment. Antibiotic treatment or penicillin treatment must continue. This Jarisch Herxheimer reaction is managed with supportive care such as fluid, rest, reassurance, and with antipyretics, that is fever reducing agents like paracetamol. So antibiotic treatment should not stop, they must continue. In pregnancy, Jarisch Herxheimer reaction can cause temporary uterine contraction and fetal distress, but this is rare. Still not a reason to stop or avoid penicillin treatment. Here, close monitoring is advised. So the difference between Jarisch Herxheimer reaction and penicillin allergy. Jarisch Herxheimer reaction is caused by rapid bacterial death, while penicillin allergy is caused by immune reaction to the drug. Jarisch Herxheimer reaction is characterized by fever and body aches, while penicillin allergy is characterized by rashes, itching, and breathing difficulty. Jarisch Herxheimer reaction occurs hours after treatment. Penicillin allergy occurs immediately after treatment. Jarisch Herxheimer reaction is self-limiting, while penicillin allergy can be life-threatening. So these are differences between Jarisch Herxheimer reaction and penicillin allergy. Does Jarisch Herxheimer reaction occur in other diseases? Like I said previously, Jarisch Herxheimer reaction is possible in some diseases caused by spirochetes, such as Lyme disease, relapsing fever, and leptospirosis. All these diseases I just mentioned are caused by spirochetes. So the answer is yes. Jarisch Herxheimer reaction is possible in some diseases. It can occur in some diseases caused by spirochetes. So Jarisch Herxheimer reaction is self-limiting and resolve within 24 hours. It does not affect treatment success. This is common after syphilis treatment. It reflects bacterial destruction and also temporary and harmless. Treatment must continue and patient reassurance is very crucial. The Jarisch Herxheimer reaction is a temporary inflammatory response caused by rapid killing of the syphilis bacteria Treponema pallidum after treatment. This is not a penicillin allergy. This is not antibiotic allergy or drug allergy. Feeling worse after treatment does not mean treatment failure. It means that the drug is working. The Jarisch Herxheimer reaction is common in secondary syphilis because secondary syphilis has the highest number of the syphilis bacteria, Treponema pallidum. Also, the Jarisch Herxheimer reaction is common in secondary syphilis because this secondary syphilis has the highest bacterial load, leading to massive bacterial death and intense inflammatory response after treatment. This reaction reflects high bacterial burden and effective antibiotic action. This is not a drug allergy and it is not a treatment failure. Also, it is not a drug toxicity. Rather, it is a signification of rapid bacterial death. Since Jarisch Herxheimer reaction is not a drug allergy, treatment should not stop and must continue. If you stop treatment early, it will lead to antibiotic resistance. So treatment should not stop early. Treatment must be complete. Other factors that contribute to antibiotic resistance are self-medication, using the leftover antibiotic, using the wrong antibiotic or using the antibiotic wrongly, purchasing or buying antibiotic without prescription, sharing antibiotics. These are factors that contribute to antibiotic resistance, so they should be avoided. Jarisch Herxheimer reaction is not a reason to stop antibiotic treatment. So if this video is helpful and educative, like, comment and share. Subscribe to this my channel. Follow my page. Thank you so much for listening. See you next time.